everyone, I'm Anna Webb and welcome to A Dog's Life. In this episode, I'm thrilled to be joined by Gordon Maclellan of the Pupscan project, and we're talking about hip dysplasia in dogs. Gordon Maclellan, thank you so much for joining us on A Dog's Life.
Thank you. It's lovely to be here, Anna.
Well, we met at Crufts just last week, and I was so interested to chat with you because you are a retired orthopedic surgeon. You're also mad dog lover, a massive, I should say, dog lover, a breeder of Belgian Shepherds, and you are the founder, I think, of the Pupscan project.
Yes, that's right. My wife and I founded the Pupscan project 10 years ago because we were trying to get at the roots of canine hip dysplasia along the same lines as we have done with children during my career as a human orthopedic surgeon. So when I retired from the NHS and gave up my orthopedic practice, Pam talked me into getting stuck into sorting out hip dysplasia in dogs. And so that's how we got there.
I love that. Well, hip dysplasia, elbow dysplasia, a lot of joint issues really affect so many breeds. And what have you found in your initial research?
Well, to start it off, just to give you a little bit of background, when I became a consultant in orthopedic surgery in East London in 1984, we had just come across the research done by Graf and others into ultrasound scanning of infant hips. And this was being done very soon after birth to diagnose hip dysplasia in babies. The object being that it could be identified and treated without all the complications and so on that went on with the surgical approaches. And we managed to get a grant to buy our first ultrasound scanner and set about scanning all the at-risk baby hips in East London, or my bit of East London in Romford. And I was almost able to eliminate surgical treatment of hip dysplasia in infants within about 3 years. And it was an absolutely revolutionary change in pediatric orthopedic surgery. I couldn't quite understand why the same science had not been applied to dogs. And so Pam said, well, you sorted it out in children, so why don't you get to work with dogs? We spoke to some very experienced breeders. I mean, Pam's a very experienced breeder herself and has had huge amounts of success in the show ring with our Belgian Shepherds and her Irish Wolfhounds before that.
Oh, Irish Wolfhounds. Oh, gosh.
Oh, yes. Yeah, we had 4 Irish Wolfhounds and 2 Belgians at one time. But we now just got 12 Belgians.
12. Gosh, well, that's a huge amount of work. We digress. Please continue because this is so interesting.
Yes. Well, so what we did, we first bought ourselves an ultrasound scanner to make sure we could get diagnostic quality pictures of a dog's hip that were comparable to the pictures of a human hip. And we were very quickly able to find not only could we get good pictures, we didn't have to shave the dogs. So we didn't run the risk of damaging their coats or changing coat color or anything like that, which can happen if you shave a dog. And so we were able to get excellent images. And Pam very quickly picked up the technique for doing the ultrasound scans, even though she has no medical training. She'd worked as a veterinary nurse some years ago, so she's pretty good on the 3D image of an inside of a dog. And so, yes, we were able to go around the country, both in the UK and Ireland, scanning hips at the request and with the support of hundreds of wonderful breeders who gave us their litters to scan and investigate over the subsequent few years. Our most senior advisor, who had bred many breeds of dogs over the last 50 years, reckoned we'd have to scan about 2,500 puppies before we got anything that was statistically significant, because we were dealing with over 200 breeds we might have to investigate. And as you said, it's common in so many breeds. We didn't know which ones it was common in and which ones it wasn't. And the
Yeah.
previous research that had been published in 2009, 2010 hadn't found any dysplastic hips in the breeds that they had investigated, which were about 17 breeds, as I recall. And so we knew we had to do much bigger numbers and many, many more breeds before we had any conclusions.
Absolutely. I mean, of course. Now, because the thing is this, isn't it? I suppose the big question is, are dogs born with a genetic code that can target specific joints? Or are joint issues, I should say, an accumulation of a variety of environmental factors? Is that the kind of point of your research?
Absolutely, yes. And you know, the research, you'll have seen the papers yourself, but there have been numerous research papers looking for a genetic cause for canine hip dysplasia, just as there have been in human hip dysplasia, of course. And so far, neither in humans nor in dogs has any gene or group of genes been identified to be responsible for faulty hip joint development. Because dysplasia is just a word meaning faulty development. It doesn't mean anything else. It's not a diagnosis.
I love that. I love that terminology, Gordon, because it's the same as inflammation, actually. You know, pancreatitis, cystitis, you know, all of this is inflammation of the bladder, inflammation of the pancreas or whatever. You know, it's the itis, isn't it? It's Latin.
It is, but it doesn't tell you why it occurred.
Exactly.
And you know, years and years ago, we were taught, and all vets are taught the same thing, of course. You know, first make a diagnosis, and using a descriptive term like dysplasia is not the same as a diagnosis.
No, absolutely. Now, interestingly, I'm not sure I discussed this with you at Crufts because I know I was so excited to meet you and have the conversation, you know, but I mention that my little dog that you met at Crufts, you know, my little English toy terrier, Mr. Binks, he was standing on the ground at the time, so you may not have noticed him awfully, but he has Legg-Calvé-Perthes disease. So yes, at 9 months old, he had his left hip joint removed. He had big surgery very young in his life, obviously, followed by a broken front leg, which was definitely environmental. I don't know anything about how that happened or who helped with that because it was before I'd rehomed him, you see. So he came quite literally broken and stuck back together again, actually, really thinking about it. He's now 13, actually, Gordon, and I'm proud of this. But it's always been this big mystery, you know, and he's still on 4 legs, and you saw him striding around Crufts. You know, he's pretty good for a 13-year-old dog. You know, most can barely walk, you know, even if they haven't had a hip removed and a broken leg. However, I digress. But my point is there's always been this mystery. Is it idiopathic? Is it genetic with PERVs? Or is it environmentally triggered, you see?
Well, we have exactly the same questions in humans. And I was a very small cog in a very big wheel investigating this with the help of the Royal Veterinary College in Potters Bar back in the late 1970s, early 1980s, when at the veterinary college they were studying Perthes disease in beagle dogs. And beagles, of course, have been one of my most favored and respected breeds ever since. They really did the most wonderful piece of work on Perthes. And it was just at the sort of time that we were learning in human Perthes disease that by the time you make the diagnosis, the femoral head is already healing. I'd been doing some work in Boston before I went back to the Royal National Orthopedic Hospital, and there they'd introduced isotope scanning in children's hips, or for children's hips who have Perthes disease. And these isotope scans showed that by the time you got an X-ray change of Perthes disease, the femoral head was already healing. And the work at the Royal Veterinary College established one of the main mechanisms behind the appearance of Perthes disease in a hip. which is for some reason, the blood flow to the hip is interfered with, either on the arterial side or the venous side, but either way, the flow is interfered with. There's a drop of oxygen tension in the growing bone cells in the femoral head, and it then goes soft. And what you get in this X-ray appearance, it looks as though the femoral head is fragmented, but actually it isn't. It's the patchy loss of mineral in the bone is because that dead bone is being removed by the body's repair process and is being replaced, provided the head is kept in a mold and it's the right shape, by healthy bone again. So Perthes disease over time will heal.
That's so interesting, Gordon, but that's so interesting because every single, obviously, Mr. Binks, that's his name, was uninsurable, because of the Perthes. I like the way you say that condition. And, mostly we've always stayed with one vet, Barbara Jones in Shropshire, actually, an integrated vet who runs an organic farm, and the practice is amazing. You may know her. Anyway, if you don't, I must introduce you. I must introduce you. You'd love Barbara Jones so much. It's an organic farm. She owns all this organic land. I mean, it's like going actually for a vet visit to, All Creatures Great and Small, the television series of old. It actually is that, there's a calf in the car park in the lovely bit of grass. Anyway, I really digress. It's just that every single vet trip we've been to, apart from with Barbara, vets are just like rubbing their hands going, well, how is Mr. Binks's other hip? And I have to say, well, look, as you can see from the muscle built around his thigh bone and the fact that he's trotting along quite merrily, actually, in his own little way, would indicate to me there's nothing actually wrong with it. Oh, but we need to do an X-ray and all the rest of it, okay? Oh, it has become quite tedious over the years. I mean, we haven't changed vets that much. Anyway, the long story is, obviously, I have not investigated removing that hip joint as well, which is what the vets have suggested. And then that would leave him, quite disabled, really. I mean, he would still have his muscles holding his leg onto his body, which we keep very strong and very nutrient dense, shall we say, through the right exercise and diet and environment and so on. However, that throws a different kind of picture onto things, doesn't it, Gordon, in a way? I mean, he's had it X-rayed. It is smaller than it should be, that hip, on the last X-ray with Barbara, where, he didn't have a general anesthetic to have that X-ray, because, that doesn't help. You know what I'm trying to say.
Can I just say, though, that Perthes disease only occurs during growth. So once growth is complete and the growth plate at the top end of the thigh bone has closed with the femoral head, then Perthes disease as such cannot exist anymore. So the adult version of Perthes disease is avascular necrosis, and often abbreviated just to AN. And avascular necrosis, again, occurs because the blood supply to the femoral head has been interfered with in the mature skeleton. That can be triggered by things like steroid treatment. If, for instance, in humans, we see it occasionally where somebody's had a severe head injury, and because of their brain damage, they were treated with steroids to lower the pressure within the brain. But occasionally, you'd see avascular necrosis develop in a hip or in a shoulder or something like that. So there's other external triggers that can disturb blood supply, which are quite surprising at times. Working in tunnels, for instance, or getting the bends if you work in deep down in the ocean, that sort of thing can trigger avascular necrosis. But it's not a hangover unlikely to occur in the opposite hip, having had Perthes in one hip.
That's so interesting, Gordon. Thank you for that clarification. Well, he's still got a hip joint in his right. Yes, absolutely. No, so the overall results then of your study, what you were mentioning to me at Crufts is extremely interesting. So explain the overview of what you have discovered.
Well, we've now scanned over 70 breeds of dog, large and small, and all have been done before 8 weeks of age, which is when the puppies leave home and go to their new owners. So we know that the whole litter, and we've always scanned the whole litter, we've never just done one or two from the litter, but we know that the whole litter have all been in exactly the same environment, on the same husbandry protocols, as it were. And so if one were to emerge in the litter that had a dysplastic hip, you would have thought perhaps one of the others might have it if it was genetic, because we were planning to get samples that we could send off for genome analysis if we came across when we came across dysplastic hips. Well, after the first 3 years, we'd only found one dysplastic hip. And it was only on one side, so clearly wasn't genetic, because genes don't decide I'll just do the left or I'll just do the right. That wasn't genetic. So after 3 years, we still had no material to send to the geneticist for investigation, which was interesting in itself. When we got to the 5,000 hip mark, which was our original target, we'd by then only found two that were dysplastic. Both were on one side only. Both were in male dogs, and in humans, hip dysplasia is commoner in girls than boys by quite some margin. So that was a surprise as well. So we had to start thinking of, well, what is causing hip dysplasia in dogs? Because they're clearly not born with it. Something happens after birth. So we had a lot of academic discussions with people in various European countries, and indeed some researchers in America who I was familiar with. And we got on to looking for the real causes of hip dysplasia, because clearly genetics is not an important factor. It may not be a factor at all. And in humans, we haven't found a genetic cause for hip dysplasia either, even though when I was in my training years, it was very much thought to be genetic 50 years ago. But today, that nobody has still managed to find a gene or collection of genes or a SNP or anything else that is consistently associated with hip dysplasia in humans. And it looks as though exactly the same is true for dogs.
So, Gordon, when do people normally discover that their dog may have, hip dysplasia? I would assume, maybe I'm wrong, that elbow dysplasia might follow the same school of thought.
Yes, elbow dysplasia, again, is a basket of different diagnoses, all lumped together with the label dysplasia. But if you actually look at the veterinary textbooks, they're pretty clear about things like, for instance, the fractured anchoneus process, which you can see usually in dog x-rays if you take a lateral view, or the fractured coronoid process. These injuries are caused by jumping from a height. Small dogs jumping off furniture, or for instance, dogs jumping off a stair, going down a staircase, things like that, especially if the muscles are tired or the dog is tired, the puppy is tired, can fracture the anchoneus process. And this is in the textbooks. There's debate about how it should be treated, but there's no debate about what causes it, I don't think.
No, well, absolutely. I mean, it sort of is logical. I mean, puppies are fragile. Yes, they can bounce. I've heard toddlers are supposed to bounce as well. But I know that my miniature bull terrier, she has a slipping kneecap. It definitely was an injury when she was a puppy. Miniature bull terriers are extremely bouncy, extremely strong-headed. And, she did take a tumble and down the stairs. Not intentionally. A massive accident, and she's fine, and I still treat her slipping patella pretty much on a daily basis using red light therapy, but all my animals have always been fed on an inverted commas anti-inflammatory diet, meaning a fresh whole food diet, because diet can actually exacerbate joint malformation. Or am I being
that's a huge topic in human hip problems, mainly the slipped upper femoral epiphysis, where the growth plate at the top end of the thigh bone displaces. When growth is progressing very rapidly in a dog, or I mean, most of the work has been done on rats, mice, and so on. But when there's a period of rapid growth going on, the growth plate that making the bones longer actually gets weaker. And if you want to slow growth down a little bit, one of the very wise men who has advised us over the years says that all you have to do is change the protein level in the dog's feed for 2 or 3 days. And if you halve the protein intake, suddenly growth will slow down again while the body adapts. And then a few weeks later, 3 weeks or so later, you can revert to the previous feeding pattern. But you can just slow growth down a little bit so that the muscles have got a chance to catch up. We're at our most vulnerable when the muscles are fatigued or weak for any reason. And we're most vulnerable to the weakest muscle in the group. And that may be something to do with why some kneecaps dislocate. Some kneecaps dislocate for a genetic reason. But that's very small print at the moment, and I don't know whether that applies in dogs as well as humans. I'm longing to find out, because there are some breeds that seem to be more affected than others.
How interesting. I mean, you do see a lot of terriers traditionally, your Jack Russell,
Yes.
yes, that has, and some people think that's the way they walk when they go step, step, hop, step,
Yep.
step, hop. It's like a dance, but it is in fact a dislocated kneecap, I guess.
But the Jack Russell at Crufts last week wasn't doing that.
No, that's true. But I mean, there again, he's not the sort of Jack Russell I've got in my mind's eye at the moment. I'm thinking about, the old fashioned Jack Russell that wasn't a Kennel Club registered breed, that was just the farm dog, the mighty
Yes.
ratter for centuries. They came in wire coat, they came in smooth coat. Some had floppy ears, some had pointy ears. Some were very, very short, some were a bit longer, that Jack Russell.
Yes, indeed.
Yes. Oh gosh. So what's your advice, to somebody who may just have taken on a puppy, in terms of the environment they're living on? I always say things that be so aware of slippy floors,
Yes.
where tiny micro lesions will be happening all the time. You see on Instagram sometimes some videos that, they make me cringe, where, because a lot of people have got this very slippy floor now, I mean, I get it. It's, I guess, easy to clean and so on and so forth. And, but you see dogs and their feet are barely, there's no grip. They're like on ice.
It's very interesting, isn't it, how the problem of canine hip dysplasia seemed to arise after the Second World War. Nobody was talking about it much before the Second World War. But I was also told that most vets didn't even have X-ray facilities before the Second World War. So making a diagnosis with the help of X-rays was quite a rarity in the veterinary world before the war. And of course, the other thing that happened after the Second World War is we changed our environments a lot. And this sort of slippery surface that you're talking about became much commoner. Many more dogs were kept indoors than outdoors in the kennels. And so we introduced dogs to our environment. But the dog didn't evolve for our environment. They evolved for a canine environment, which is entirely different. So I think most problems that we're seeing of these sort of musculoskeletal injuries are really caused by humans imposing an unfavorable environment on dogs. And we should respect that, and we should care for our dogs much more carefully in attending to the environment they live in.
Absolutely. And surely, I mean, absolutely. Gordon, gosh, I do really. It's actually brought a tear to my eye hearing you say that.
I'm sorry about that.
No, it's all right. I'm just sort of an emotional.
Like make a girl cry, Anna.
No, not, but I'm so emotional when it comes to the world of dogs, because I do help people, on a regular basis. I'm actually later today going to see a puppy who's 3 days into her new environment. And, I need to get I'm just going there because it's easier just to go. I need to see the layout of their home properly in person
Hmm.
and all the rest of it, really, because things are there. I think they've underestimated how easy or not actually it is to bring in a puppy, into a brand new environment because they've not
Yeah.
done that before. And it's a baptism of fire, quite frankly. Yeah,
Hmm.
funnily enough, yes, puppies aren't born trained. No, that's it. But anyway, it's another story. But look, I'm very interested in this interplay between the environment and health, and I do believe there's a lot going wrong, actually, not least, you've mentioned before the war. It's such an interesting thing to say because I visited the oldest pet cemetery in the world. I lived in Paris for a while, and you've got Père Lachaise, one side of Paris where Jim Morrison is, and Balzac and Oscar Wilde and a few other key celebrities. But then on the other side of Paris, on the west side, you have the Cimetière des Chiens, which is the most amazing graveyard for dogs where, oh gosh, the dogs go back to the 1850s in there. I mean, it's extraordinary. And it's the most biggest outpouring of grief, some of these epitaphs, from way back. So, you can see
Yes.
dogs broke people's hearts in the mid 1850s, I mean, and obviously way before that. But what interested me the most of my visit was that the younger the graves, the younger the dogs.
Hmm.
Okay. I mean, look, Rin Tin Tin was said to be buried there. He's not actually. We did a podcast about that. He is, they think, no one knows for sure, but in Los Angeles. But there is a tomb, an epitaph to Rin Tin Tin. He was a German Shepherd, as you know. He lived to the age of 17. He'd had a very, very active life, I mean, and a very famous life. He saved Warner Brothers from bankruptcy and a few other great things, and he had a good life. But he was 17,
Yes.
and he didn't have, I think he got a bit stiff towards the end, but this was in an age way before there were even painkillers available, I assume, for humans.
Yes, modern painkillers, of course, have changed our lives dramatically, especially dealing with arthritis. Have been wonderful, wonderful inventions. Thank goodness for them. Where would we be without them?
I know, but I mean, if you overuse painkillers, though, they can become addictive.
Yes, some painkillers can. There's a difference between addiction and habit forming, and but most people, I think, use painkillers wisely. They've been used very unwisely by some people, particularly celebrities, I think, who get themselves addicted to them because they've been prescribed too liberally, often without a diagnosis attached. And that's one of the many things I learned when I was working in Boston, in Massachusetts. The obsession with making a diagnosis, writing it down, and signing your name to it was a very strict part of one's training. And you had to make a diagnosis and justify it by putting your signature underneath and saying, I've nailed my colors to the mast. This is what's wrong, and this is how we'll put it right. That practice has stopped in human medicine as well as in veterinary medicine. So you can go with pulmonitis, for instance, a chest infection, and your GP would have said, yes, it's a chest infection. We'll get a sputum sample, we'll identify the organism and give you the correct antibiotic for that organism. That stopped. Now they just give you an antibiotic without knowing what the organism is. And, it's those sort of shortcuts that have led to huge increases in problems that are then much more difficult to resolve. But that's another story altogether. I mustn't stray from the topic.
No, no, okay. No, please, no, don't apologize. No, it is all, extremely interesting because I suppose it's a bit comparable, I assume, with GP doctors, who are now holding back antibiotics, whereas antibiotics was a great invention. They didn't exist pre-war either, and I think they just been introduced for human use, but I mean, they had, none of these medications had filtered down into the world of dogs until, relatively recently. I mean, back post-war, you didn't vaccinate your
Well,
dogs.
penicillin was in its infancy then.
Mm.
we had tetracycline and a few sulfonamides, but antibiotics were the reasons for using antibiotics. The indications were much more vague in those days, but fortunately, they've got much more selective about what you give antibiotics for. So you try not to give an antibiotic for a viral infection because resistant organisms emerge. And of course, that's proved to be an absolute crisis now in medicine. More and more resistant organisms emerging because antibiotics have been used too liberally and too non-specifically. But that's another story again.
Well, yes, well, that relates to a topic you'll be on the page with, I should definitely imagine, which is, the microbiome and the whole area that is our immune system, which I think is important to mention here, because if an immune system is strong and firing on all cylinders, it can cope with viral infections, for a start, but it can also, nourish the animal, human, the dog, the cat, at a cellular level, because that's the whole point, nutrients are absorbed, yes, obviously in the small intestine and so on. And the colon plays a massive role as well, which, until recently, we hadn't perhaps thought of that, what does colon do? Oh, well, just, gets rid of what's not needed sort of thing. But it's actually far more complex because obviously a dog is a whole, and that's why also, for example, I'm extremely interested in the World Small Animal Veterinary Association's latest landmark guidelines, which is not to routinely just spay and neuter, because the evidence there, Gordon, I don't know what you think of this, but the evidence over 20 years of, leading lights in veterinary science have concluded that spayed and neutered animals, particularly in larger dogs, but in all dogs, can be affected, less so apparently in cats, by the neutering and spaying process, because of course you're taking out valuable hormones, and you're a whole, you can't just think, right, let's take that out and then there won't be any consequence. If you did that to your car, it's like, well, let's see if your manual car will run without a clutch.
Well, I've done that once, but
same here actually. Not to be repeated. Pretty awful.
I was a very skilled driver in those days. Couldn't do it today. But I think from the point of view of hip joint development, we need to understand all the different factors that are involved in making bones strong and healthy and growing at the right rate and not being injured. And you were talking about the puppy going to a new home. One of the first puppies we found with an injury to the socket, the growth plate around the rim of the socket, we'd scanned it before it left the breeder at just before 8 weeks. And the puppy went to the new breeder at 8 weeks, new owner, 8 weeks and 1 day. And unfortunately, in the household, one of the children in the household had left the puppy gate open on the way into the kitchen because the owner had arranged things in one of the rooms for the puppy that was entirely fall-proof and slip-proof and everything else. But the puppy escaped into the kitchen where it started to play with the other dog in the household, slipped and yelped. So the owner very wisely rang the breeder and said, "What happened? What do I do?" And the breeder said, "Oh, well, I'll ring the Pupscan team and they'll come along and have a look." And so we drove 150 miles and scanned the puppy again. And there was the injury to the margin of the hip, which 3 days earlier had been completely normal. So this was the very first time we realized that the principle of one of the commoner causes of damage to the growing socket in the puppy hip is at that growth plate, which is at the rim of the socket. That's the bit that makes the socket grow deeply. And we have found that abnormality now on numerous occasions. It's the commonest abnormality we find in the socket growth. We've seen it, not in every litter, but probably in 1 in 10. We'll see one puppy that's had an accident. And what's more, the breeder will remember when the accident occurred. Almost always, the breeder can tell you, that happened when this happened. And the puppy gave a little yelp, was lame for a day or 2 days, and then seemed to be normal again. And that is absolutely at the basis of all this. And so when that socket is growing, the rim around the margin of the socket, the acetabulum, which goes on to form the labrum later on in life, that rim gets damaged. And what's more, that rim is still growing long after the long bones have stopped growing. So assuming a dog is skeletally mature when its legs have stopped gaining in length is wrong. And what we're now in the process of trying to do is establish growth charts for dogs that are breed specific. So, terriers mature much faster than some of the bigger breeds. So when does a socket stop growing? Well, we've got a skeleton from a German Shepherd dog that died at age 16 months, and that growth plate is still wide open. And in fact, we've now got several cases at 18 months of age where the socket still hasn't completed growth. So the whole pattern of husbandry for the growing dog has to be considered, not just in those first 8 weeks with the breeder, but the new puppy owner must understand that the skeleton hasn't stopped growing when they get that dog, even when its legs have stopped growing. This is the absolute key to the whole thing. So when does the flat bone stop growing? Probably or possibly when the skull stops growing. So you ask a dog breeder how long it is before the dog's head is finished, and you can probably get a fairly good estimate of when the flat bones of the pelvis or the shoulder blade have stopped growing as well. It's the only guidance we've got at the moment.
You see, that's so interesting. But going back a bit, and then, we'll need to wrap up a bit because I think we've talked a lot about a lot of very interesting things already in this conversation. But so can I ask this question? Why then do breeders and I guess vets as well all recommend, particularly with assistance dogs like guide dogs, some guide dogs end up not making the grade down to the fact they've got, in inverted commas, dodgy hip scores. So is this all what you've just said, that perhaps during the puppy's socialization, something's happened? I mean, accidents happen with puppies, of course. I mean, they can happen. You can't wrap them in cotton wool and never take them outside, so what I'm trying to say is, so the puppies, say for Guide Dogs Association, brilliant organization, and they have to obviously only place totally healthy, robust, fit for purpose dogs. So sometimes they don't make the grade and they end up in great pet homes and so on. Is it because they were damaged in that time during their growth phase? So basically, dysplasia and scanning and hip scores and all of these things aren't what it is, but the actual thing is dogs don't have any problems with their hips. This is what you've seen. The problems are caused by the environment.
The evidence at the moment is very much that something happens to the dog in its human environment, and we now have to get busy working out exactly what is going wrong, because there are so many different things. There's a wonderful textbook, which you've probably seen, written by a Professor Paget from the United States. It was published in the late 1990s, and he lists all the abnormalities you have to think of before you think of genetics. And the book is called Control of Canine Genetic Diseases. It's a book about canine genetics, but he lists all the things you think of before you blame genetics. And if you follow his guidance in that book, which has exactly the same guidance that we use in humans, you can't go far wrong. Follow George Paget's diktat in that book. It's on page 3. It's right at the beginning of the book. You can't miss it.
No, I was given this to read in my study I did with the College of Integrated Veterinary Therapies. I remember this. I mean, this is obviously what natural healthcare kind of prioritizes, yes, really, and helping people get it right. Oh gosh, Gordon, it's so interesting. So what's the next thing you're going to be working on?
Well, at the moment, there's some new research coming out very soon as part of somebody's thesis, which I'm not allowed to talk about yet because it's still under wraps.
Love
but that will be emerging before long. But it's extremely important in terms of confirming the way the dog hip grows is entirely corresponds with the way the human hip grows. So that's really important. And then the next stage that we're looking at, which I hope breed health coordinators will be able to work with us on, is to do these growth charts, breed-specific growth charts, so that owners know when their dogs have stopped growing. I think it's so helpful. It's also helpful to know that bitches stop growing a little earlier than dogs, just like in humans. But the similarities between dogs and humans are getting more and more evident to us. And that is why I hope before too long, we'll have breed-specific husbandry guides that will include advice about the sort of activities that are different, that breeds can do. And they will be different to terriers from wolfhounds in a very big way.
Yes, no, absolutely. Absolutely. Oh gosh, this has been such an interesting conversation, Gordon. It really has. And I'd love to chat with you, all day, to be honest with you, because there's so much to learn and we've got quite a few views in common and everything. So, thank you for this. And I hope, that the research, which we will talk about again, I would love that, it could help guide people, that, in many ways, couldn't it? Gordon.
It's very exciting, Anna. We've now got good evidence that there's a lot we can do to stop dogs becoming arthritic later in life. A heck of a lot we can do. And now we've got to get on and do it and stop calling everything dysplasia. That term, as far as I'm concerned, should be consigned to the dustbin of history. Get rid of it because it means nothing. It's just like it's saying something's wrong with it. And that's not good enough.
No, it's almost like you're making the problem, creating a problem. I always say, arthritis isn't a given. I mean, there's a woman in my yoga class who's over 80. I really think she hasn't got arthritis. She's, and it's all about the environment. And I am very strong on diet as well, as but we can chat about that on another occasion. I really also want to chat about what it's been like with your Irish Wolfhounds, because many, many years ago, I was just obsessed by the story of Finn, the Irish Wolfhound, and Beth Gellert. And so, I made my dad do a massive detour when we were in Wales to go to Beth Gellert, I don't know how you say it in Welsh, and to see, his shrine, the amazing story which you all know all about. I can't even, this is how emotional I am these days. Yeah, so there we go. Dogs are amazing and we need to sharpen our pencils. Thank you so much, Gordon Maclellan of the Pupscan project, and I can't wait for you to join us again.
Thank you very much, Anna. It's been a joy.
That's our show, everyone. I do hope you enjoyed it. If you did, go on, rate and review the show wherever you tune into your podcasts, because it really makes a big difference. Thanks again, of course, to Gordon Maclellan for joining us today. And all the links to the Pupscan project you've got it in the show notes. Thanks, of course, to Mike, my producer, for all the music and recording and editing as ever. Find out more about Pod People UK, the links in the show notes. And same with me. You can find all my links in the show notes as well. So don't forget, it's free to subscribe. And that way you'll never miss another show. Bye for now.